Allie Gordon with NurseGoneCrunchy.com. I help mamas with school age and younger children to balance their hormones naturally, drop that baby weight, and start to feel vital again. And today I really want to talk really quickly about your thyroid, what it does, signs that it's not working properly, and kind of guide you to resources to help fix that. I chose this topic today because a lot of the symptoms of thyroid disease are actually thought to be kind of normal symptoms of being a mom. You know, oh, I'm tired. Oh, I'm having a hard time losing weight. I just don't feel engaged in my life anymore. I don't feel happy. I feel like maybe I made a mistake. You know, a lot of things that you hear women say. And yeah, some of that can be related to being a mother. And a lot of it is also what you find when you have thyroid problems. And I feel like women are often marginalized and said, oh, whatever, you're totally fine. It's like, but maybe we're not. So I really wanted to come and talk about this, kind of empower you to know what those symptoms are, and to give you some resources so you can reach out to your provider and hopefully get the testing that you need and identify if you do have a thyroid issue so that you can start to feel better and not just say, oh my God, being a mom is so hard. So it lives right here. It's actually shaped like a butterfly, which is really cute. And it secretes thyroid hormone. Now, hormones are kind of chemical messengers that are sent throughout your body and communicate with your cells. So it's one of the ways that your brain kind of controls what happens all throughout your body. So it's really a cool thing. Now, thyroid hormone really is involved in a lot of things. Most commonly, we think of metabolism. So if you have a thyroid issue, you know, I know when mine was really bad, I would look at lettuce and I seriously thought I was gaining weight. Like no matter what I did, I just gained weight. It affects your mood. So a lot of people who have depression also have thyroid issues. It also helps you to maintain a healthy pregnancy. So if you've had multiple early term miscarriages, they'll actually test your thyroid because having thyroid disease will make it so your body is not able to maintain a healthy pregnancy. So really involved in a lot of things. When our thyroid's working well, we're energetic, clear-headed, we're upbeat, our weight is managed really easily, we digest our food well so we don't have diarrhea or constipation. It's like that nice middle ground, right? And we have a normal body temperature. How many of you, like me, need to wear socks all the time? Like to wear covers even when other people aren't? And for me, it's because I get cold really, really easily, and that is part of having thyroid issues. Again, fatigue, and not just fatigue, but like profound exhaustion, which again, when you're up with your little ones, yeah, you are gonna be tired, but also it could be a thyroid issue. Poor mood, so if you have depression, anxiety, struggle with just feeling blah, that can be related to your thyroid. Again, infertility or miscarriage early on can be related to thyroid imbalances. Having brain fog, again, you know, that mommy brain, how much of it is because of having your kids and how much of it is maybe a thyroid issue. Difficulty remembering things, again, that mommy brain piece. And then gaining weight and struggling hard to lose it is another sign that you might have a thyroid imbalance. In the United States, the majority of people who have hypothyroidism, it is an autoimmune condition, which means that your immune system has lost the ability to determine self from non-self. So your immune system normally would not attack your own healthy tissue. However, through a lot of different reasons, which I'll be talking about in other lives and on the blog, your immune system can become confused and actually start attacking your own tissues. And we in the medical community call that an autoimmune disease. So your immune system is attacking yourself. And what can happen with that is it actually destroys your thyroid and can cause you to not have enough thyroid hormone to have a healthy metabolism and a healthy mood and all of these things. So if and when you go to get tested, please ensure that they're doing all the testing that needs to be done. talking about what you need to have tested. And I also have a cheat sheet on my blog, so if you head over to nursegonecrunchy.com, you can go ahead and download this amazing free guide. It has all the optimal levels for the ranges that you want your thyroid labs to be within, and it talks about how to interpret your labs. So really awesome and helpful, and that's free for you. So just head over to the blog and download that today. Please make sure that you're getting everything tested properly. And I also at nursegonecrunchy.com have a free thyroid and other hormone imbalance symptom quiz for you. So you can just go in, download this quiz, and just check off any symptoms that you're having. And we're looking at your sex hormones, so estrogen, testosterone, progesterone. We're looking at your adrenal hormones, which are elevated and or low when we have too much stress, and none of us have stress, right? And it also looks at your thyroid symptoms. So it'll give you a big picture of what's going on with your hormone system. So please head over and check those things out. And remember that just because you're a mom doesn't mean you have to feel like shit. And it could be because you're having some hormone imbalances. And I just want to make sure that you're not writing off symptoms that are telling you something's wrong just because you're a mom. And because we're moms, we need to feel better, right? We can't pour from an empty cup. And taking care of our littles is so important. So please take care of yourself. Take 5 minutes, go to nursegonecrunchy.com, download those free resources for yourself, and start to feel better.